Okay. Hello. Good afternoon there. Good morning, good afternoon, good evening. Wherever it is you are joining us from, it's a pleasure, it's an honor to come your way again today on Living LTV Live with me, Gbenga Adebayo. And today, we are doing something new. We are also streaming live on Instagram at Dr. Adebayo is the handle on Instagram that you can join us as we stream Living LTV live with me. So we have a host of questions we're going to answer. It's been a long time. We've been away for a while. uh, Apologies for that, and we are back now. And hopefully, fingers crossed, we hope that we will be coming our way every Friday 3 p.m. West African time. If you are joining in, wherever you're joining in from, thank you for joining us. I hope that this session will be a great time to learn, to discuss, and to answer any of those burning questions, health questions that you may have. Okay, so great. Let's go right to it. Let's start to ask the question. You can at any time, either on Instagram or on YouTube, you can punch in your question into the chat box, and I will be happy to answer them. So let's go ahead and start to answer our questions. Let's have the very first question and put it there. Why the questions come up? I think we shot a video, and one of the issues that women are with, and a lot of women are afraid of, is fibroids, right? No, we've done fibroids several times on the show, but it is understandable uh, why people may have concerns and challenges about fibroid, about leiomyoma, as we call it, the big English. Don't mind, it's just a tumor of the small muscles. I saw a video of someone that was going about and saying that the reason why people have fibroids, why women have fibroids, is because of promiscuity, that they are sleeping up and down, that when sperm join with these, just saying rubbish confidently. Um, that's as far from the truth as one can get. You do not get fibroids because of promiscuity, right? Fibroid is a tumor of the smooth muscles of the, in this case now, of the uterus. You can get tumors, smooth muscle tumors of any other place that has smooth muscle in the body, of that kind of muscle. So you can have it, but when it's in the uterus, we call it uterine fibroid. So it's not because there are a host of factors, genetic factors, hormonal factors, why that happens, but it is not as a result of promiscuity, right? No. So I hope that is there. So is there a link between certain foods and migraine triggers? I get a headache, and whenever I eat certain things, it's possible. It's we never say never in medicine. Anything, anything can happen. So if you notice that once you eat certain things, I think probably you should just avoid those things, right? So it's possible. There are different types of headaches. There are different things that bring on headaches and trigger headaches in people. So if you notice that every time you eat certain things, that probably triggers a headache, it could also just be coincidental anyway, but it's possible. So I'd advise that you stay away from those things, right? That'll be my advice. Great. Next question, please. Welcome everyone that is joining us. If you are joining, please, you can just say I in the chat box so that we can know that you are here. You are here. What other ways can I manage chronic pain like arthritis apart from surgery and medication? Right. Sorry to hear that you have osteoarthritis. That's wear and tear disease of the joint, usually the large joint of the body. So there are a few other things that people can do. Physiotherapy may be helpful. I've seen a lot of videos of people doing really, really, really dangerous maneuvers when the chiropractor, when they just break, do all kinds of stuff. Please be careful of those things. You may actually be causing more harm than good. So medications, conservative management is the mainstay. We want to see if we'll try conservative management first, right? And if that does not help and someone is not mobile, is getting worse, please, I'd like to encourage you, don't be afraid. Surgery is safe in the right hands. Where the patient has been carefully selected, the intervention has been carefully planned, and the procedure done by someone that is competent. Surgery is the definitive cure for osteoarthritis, at least for those conditions where the joint can be changed. Because what osteoarthritis simply means is that the covering, well, you have a joint that's come together. So let's say two bones are rubbing together. They have the two bones, cartilage covering them, and then you have some fluid so that they move together without friction. They move together well. Osteoarthritis means that the surfaces, right? Something has gone wrong, right? It means that something has gone wrong, and people can no longer, those joint surfaces can no longer move properly together. So what do we do? If we change it and we make them brand new, the pain is gone. So there are a few other things, but whatever it is, just let's first be sure that the diagnosis is correct, that it is osteoarthritis and not something else. It's not gout, it's not rheumatoid arthritis, it's not whatever it is, it's not something else, right? It's not, God forbid, it's not cancer, right? So that we can find out what is wrong with you, and then you can be properly advised, and then you can get the treatment that you deserve, right? The treatment. So the important thing is to be pain-free. So let's get pain-free, right? Thank you. Okay, next question, please. Welcome to everyone that is joining us, watching live. Thank you for joining us. You can ask whatever question you want, and we would answer them. We have a few minutes. By 3:30, we'll have to run along, but we still have good time, right? How can I overcome insomnia? That's something a lot of people grapple with, right? Sleeplessness. So we've done a lot of, we have quite a bit of content about sleep, why you need to sleep, the importance of sleep, the science of sleep. And if my colleague can find some of those things, they can please drop the links to some of this content in the chat box so that you can go take a look at them later. So the first thing first is for us to, how do you combat insomnia? It's for us to find out why you're not sleeping, right? So we need to have a sense of what is stopping you from sleeping. What are the issues? What are the problems what's stopping you from sleeping? Is it a medical problem, or is it something that we need to treat, right? Like something in your body, something wrong, or is it just a behavioral issue, or an emotional issue? If there's no pepper in the pocket, it stands to reason that sleep may be difficult. If there's no, if things are, you have issues that are concerning you, and a lot of people right now, all over the nation, wherever you are, the cost of living crisis globally is giving a lot of people. I saw one video of somebody that it was say there's an age you get to, there's an age you get to that you wake up before your alarm wakes you up. So you just hear a voice, something just whispers to you, school fees is coming, your rent is due. You just wake up. So, but so if we find out what is causing that insomnia, that sleeplessness, then we deal with it. Then we address it. That we talk about it. It could be bad habit. It could be bad sleep hygiene, right? Some people have poor sleep hygiene, right? It could be their bed. It could be your pillow, right? So we address it so that you can get as much sleep as you can. So, but what we advise against is to get addicted to sleeping pills, right? All sleep are not equal, right? There's sleep and there's sleep, and we don't want you to go and start taking. No, some people say they take alcohol that helps me to sleep. That's not true. So the video is right there, the secrets and the power of sleep. So watch it, and I believe you'll pick up one or two things. And if you are joining us, thank you for joining us. Please share this link, share it, let people know we are live, like this video, put comments there, react to it, so that more people can get to benefit from the things that we are getting. So, am I at risk if I buy an anti-malaria without and use without visiting a doctor? If I just bought the drug the doctor recommended the last time. We don't want you to do that. We don't want you to just use. No, the place for the use of anti-malaria. So people that, for instance, and it's happening in these days with Japa, people that have gone. Anybody that is in this environment, right, that is not predisposed, that is not sickler, you after a while you build immunity to malaria. So that's why we don't even recommend, unless the child cannot afford to have malaria. In this case, we're talking about a sickler. Unless somebody is a sickler, they should get malaria. They will get it. It's endemic. It's prevalent here. We just say it. So, but they should be diagnosed on time and treated appropriately. Right? Diagnosis now, we don't just use anti-malaria drug, because not all fever that your body is hot does not mean you have malaria. Right? That your body is hot doesn't mean you have malaria. Different things make people's body hot. So at this time now, a diagnosis of malaria is not made without seeing, taking a blood sample and checking. So it's when we see that this person has malaria, then we treat the malaria. Because when we first got chloroquine so many decades ago, right? People were happy because you just take chloroquine, malaria is gone. Chloroquine, malaria is gone. If chloroquine was not discovered, it's possible that Africa will not have been conquered. That is certainly not tropical Africa will not have been colonized by quinine and because malaria was just wiping people out. So that takes me to the point I was making, that if somebody does not have immunity to malaria, has traveled abroad, and is coming back, that person needs to be on anti-malaria. But you are here, you are in Nigeria, how will you be taking anti-malaria all just by yourself? No. In fact, you shouldn't use any malaria medication without a diagnosis, a proper diagnosis that malaria is here, and then we treat the malaria. Because not all the time that you have fever, that you have malaria. Hunger cause fever. If hunger wire you reach one level, your joints will just stay. You go just, those are the people that are fasted for long. You understand everything they say now. So please don't just use anti-malaria medications unless with the instruction of your physician. I hope that's clear. Right. So please, let's like this video. We have 0 likes at this time. Please like the video, click the like button so that we can know that you are here, and subscribe to this channel if you have not subscribed. Please share this link on your links and get everybody to know that LivinghealthTV Live is back and better. So now we're on 2 platforms, on IG and on YouTube. Okay, what are the specific screening tests or checkups I should undergo regularly based on my age and family medical history? You've answered the question. I think the question is basically answered. Is dependent on your age, right, and your family history. So what has happened? We have some basic tests that we'd like everybody to do. So once they reach the milestone ages, that they're 40, 50, a woman may need to do, of course, the mammogram, the breast scan, cervical screening, very, very, very important. Cervical screening, pap smear too. So cervical cancer should not kill any woman anymore. Right? Cervical cancer should not kill any woman because this is slowly growing tumor. It takes over a decade for cervical cancer to kill. So if we catch it on time, we're able to cure it, not just catch it, cure it. And even nowadays, and thankfully Nigeria has also joined that scheme of giving our young girls the vaccine, the HPV vaccine, because of course, the large majority of people that have cervical cancer get it as a result of infection by the HPV, right? The human papilloma virus. So if you cannot get the human papilloma virus vaccine, then we prevent cervical cancer in our women. So young girls that before they become sexually active are encouraged to get this vaccine. So do the tests that are appropriate for your age, and no matter the age, hypertension is there, diabetes is there. We screen for all this. As you get older, you can screen for specific cancers, right? Men, of course, your prostate cancer screening is really, really, really important. Colon cancer screening, just basic screenings. And once you've done some screening, not that you do, it's not like you do it every year, you know. Because why are we doing screening? So when they say, why are we doing screening? Something will kill somebody. I know some people that say, don't do screening, because if you don't do screening, you won't know anything is wrong with you. It's when you do screening, they will find something that is wrong with you. And they will, no. That you don't know doesn't mean ignorance is not bliss in this instance, right? What's killing most people? Chronic diseases. When we say chronic diseases, something that has been there for long, right? But you don't know about it. You don't know it's there. And just by the time you know it's there, voila, yawa go down gas. There'll be problems. So we want to catch it on time so that we can treat it on time. We want to catch it on time so that we can treat it on time. So see your doctor annually. That's what I'd say. See your doctor every year. Your doctor will know your history, know your age, know the things that are up with you. Then he will recommend the test that are appropriate for you. Don't just say I'm fine, plus Jesus minus Satan. Nothing do me. We're going to be jollofing and going on. Please go for your screening, right? Great. Next question. Thank you everyone that's just joining us. This is Living Health TV Live. It's a pleasure and an honor to come your way. My name remains Gbenga Adebayo, area doctor, right? If time there, we should go area level, small, before we round up today. What are the causes of ear loss or changes in texture, and how can I treat it? Well, causes of ear loss are many, right? There are many. And part of the thing that you need to be aware of that may cause hair loss, especially in women, right, is something we call traction alopecia, right? You notice it, people that plait and weave and braid and do all these cornrows and stuff like that, they will just start going bald. And that's because they are pulling the tension as they do those hairstyles, pulls on there, and then they plucks it, and they lose air, right? They lose a lot of air. So that is a cause. And of course, we have a host of other things, autoimmune. There's a US Congresswoman who has lost all the hair on her head due to that. We call it alopecia areata. We don't know what's causing it, but we think it's an autoimmune condition where the air just die off and the air drops off. And of course, drugs. If you're on chemotherapy, some medicines, poor nutrition. Of course, we also make a child's hair to be fluffy and not looking healthy. So, of course, genetics. There's nothing wrong. Like I said, that meant that the anecdotal evidence suggests that men that have a high level of testosterone, they tend to go bald, or even the genetics, the genes. Funny, I don't think I have that gene. my head is full of hair, but the funny thing is I have no other facial hair. My facial hair is just, even if I leave it for months, nothing good for my head. So it's genetic makeup. Is part of what it is. So how can you treat it? So go see, for instance, the first thing for us to know is what's causing it. So if it's traction alopecia, then you may need to give it or prevent it, not even treat. So don't do those hair style that you pull. If you notice that your hair starts to break at the edges, then don't go do those cornrows. Don't go and do those weaves that put a lot of tension. And then you see some people do it. They actually pucker their skin. You will see it. You will see that they are pulling. No, please. Unless, of course, if you don't mind not having hair, if that's what you are trying to achieve. There's a time people like to see. If you like to do skin and just show your skin and stuff like that. But if that's not the look you're aiming for, then avoid those styles that will put pressure on your hair. If you're having a problem with hair loss, then go see your doctor. Let your doctor out what exactly is causing this. And of course, in this age and time, we do hair transplantation now. Hair transplantation is being done. So take hair from somebody else and then it takes time. Some people, the results are not so consistent for everybody, but it's an option that you can consider. Right? Great. Next question, please. Next question. If you're joining us, thank you so much for joining. Remember to like the video, share this on your screen. If you are not subscribed, please subscribe to Living Health TV or follow me on IG, right? Is snoring the only symptom of apnea? What are the other signs and symptoms, and how can it be treated? So snoring is one of the symptoms that we see. It's one of the visual symptoms. Of course, what you see in somebody that has sleep apnea, as the name suggests, is that person doesn't breathe. So if you ask what is sleep apnea, it's where somebody intermittently, as they sleep, and often it's people that have each body mass, they're big in stature, and then as they snore, intermittently they stop breathing, right? They stop breathing and then they now breathe out loud first, and then of course this is linked to mortality and cardiac adverse cardiac events. So how do we catch it? Know it. So know if you wake up and you feel tired, you feel sleepy, or you have a partner that you notice that during the middle of the night, the partner suddenly starts to cannot breathe properly, gasps for breath, so please go get help, right? Get help. Let's see your doctor. Why we are most worried about sleep apnea is the adverse cardiac event. So we want to catch as many people as possible that have hypertension, have these symptoms of heart fatigue, the whole gamut of things that show that the heart is overworking, right? We want to find it and we want to deal with it. So please see your physician, right? And of course, let's stay fit, let's stay healthy, let's prevent these chronic issues. It seems a lot of the things that we are doing today are chronic illnesses, so hypertension, screening, and I think I'm happy about that because it's important. Good afternoon, sir. Good afternoon, Madam Timitokwe. Please, what might be the cause of light blood in poo? Wow. So that any blood in feces is something we want to find, really want to take serious. You don't want to take it lightly. Any blood in feces, whether it's small, there should not be blood in feces, because there may even be blood in feces and you may not see it, right? It may be invisible, it may be altered blood. So if your stool is dark, foul smelling, or you have blood on it, or you have blood mixed in it, right? Because that means different things. If blood is on the stool, just lightly on the stool, that suggests that maybe it's a tear lower down, right? So it's bright red blood. So that means the person is constipated, right? Constipation is that problem, right? So we want to avoid that. We want to say no. So that means we need to have fruits and fiber to your diet so that you do not get constipated up to the point now that you have strain and then you now have anal tear, because it becomes a negative cycle. Strain, have anal tear. Because of the anal tear, you are afraid of going to the toilet. Because you don't go to the toilet often, you now have hard stool again, which now strain, cause tear. So you now go to that negative cycle of strain, tear, avoidance, triple, strain, tear, right? And then the person runs into trouble. So, and then of course, also other things, pal, what we call pal, not what all these charlatans call pal, what we call pal, which is just hemorrhoids, right? So hemorrhoids can bleed, and it can bleed and cause a lot of problems. So we want to avoid that. We want to say no to that. So fiber. So that's what kind of food is rich in fiber, right? Fruits and vegetables are very, very, very rich in fiber. So oranges with the things that are inside a plant-based diet generally are things that are rich in fiber, not ice cream, right? Ice cream is not rich in fiber. So the fiber, because what fiber does for you is to give some bulk to your stool and make it to pass out easily. So please get the fruit that are in season, right? Which fruit are in season now? Which one? Which one? Anybody wants to tell me one or two fruits that are in season? You can put it in the chat box if you know it. So fruits that are in season, get them, eat your vegetables, and going to the toilet will not be a major event. I think we did one video about like that. Area doctor, now area doctor do that one. Area doctor don't do one video. I say every time you go to toilet, you don't need to raise committee. You don't need to raise committee because you won't go toilet, right? You're supposed to do your matter. True and gentle. Is it only tear and constipation? Certainly not. So it's not. I've mentioned hemorrhoids, no, um, uh, the anal tears and features. If you have bleeding higher up, that's in the stomach or in the large intestine, small intestine, that will be altered blood. And you can even have blood that you cannot see with your eyes, right? And that even comes from duodenal ulcers, gastric ulcers. They can cause all that. And then, of course, if you have polyps, if you have tumors inside the intestines, they have tumors that you cannot see. God forbid, and those tumors may be cancerous. So any blood in stool should not be, just say, it happens every time I poo. Please go see your doctor. Whether it's small, whether it's big, go see your doctor. Let's find out what is behind that blood, right? It's not something we should ignore or overlook, right? Great, thank you. Going to the toilet should not be a battle. I think that's area doctor level. Maybe go worship. Maybe share them with our friends. It will be a blessing to them. Thank you. Thank you. Okay. Any other question? Let's take two more questions and then we wrap up for today. What are some diet recommendations for managing high blood pressure or hypertension? Fantastic. That's a good question. We say it often that you are what you eat. What you eat is an important part of who you are and what you become. And of course, for a disease like high blood pressure, diet. In fact, there's a directly approach to stopping hypertension, to managing hypertension. They call it DASH. And so the key thing that we need to understand for food to managing hypertension, the key thing, one of the first thing I like to say certainly is salt intake. Reduce your salt intake. Reduce. If in fact, if you can eat without salt, although that would be bland, horrible, not so nice. But whatever it is, reduce it, because salt, a high salt diet is closely linked to hypertension and in fact uncontrolled hypertension. So if you are being told that you are hypertensive, so please cut down on your salt. Reduce your salt, reduce it, right? And then take more fruit that have fiber, right? Fruit and those vegetables, fruit and fiber, really, really critical to maintaining health. Nuts are helpful to controlling and having a good cardiac health, right? Nuts, right? Legumes, those things that often we may not like to eat, they're really, really great. Yeah, the Mediterranean diet, what is called the Mediterranean diet, is a good approach to maintaining health and well-being. Great. So if you have been told that you are hypertensive, please don't take it lightly. See your doctor and do the proper thing, right? Great. Okay, so any other question? Let's take one more question, then we wrap up. It's 3:29. So is it that salt causes high blood pressure? People with high blood pressure should reduce salt. For the vast majority of people, we can't say this is what causes the hypertension. So we say essential hypertension. Essential hypertension simply means we don't know the cause. But we know that salt, a high salt diet, is a high risk factor for hypertension. So if you are not hypertensive and you start to take a high salt diet, the odds are very high that you have hypertension. And if you are hypertensive and you are taking salt,